attachments can come off, okay? You're not a bad dentist if the attachment pops off. Like it is, yes, you are essentially, right? You're just bonding composite onto the buccal surfaces of the teeth. So it's not going to be perfect every time, but if you follow these protocols, you are going to severely decrease the chance of them coming off. And if they do come off, it's not a big deal as long as that patient can get back into, or can get that attachment back on. So the protocols that I always like to kind of go over are when you're placing an attachment, the isolation is key, right? The number one reason why attachments fall off is because of some type of saliva contaminating the space. Because what does that do? That is going to decrease that bond strength between the composite and the tooth, right? So you keep the surface extremely dry, right? These are going onto enamel, so you don't have to worry about over drying the surface or anything like that. There's not going to be any sensitivity. So you then, once you have your isolation, everyone's different. You could use a lot of cotton rolls if that's what you prefer. You could use the Optragate. That's something that we like to use to kind of keep those lips and the cheek out of the way. The other thing is also the ISO Dry, right? So whatever, I know there's a bunch of different brands out there, but essentially that dry shield, something that can keep the tongue and the saliva away from the areas that you're working on.